Back pain is something almost everyone recognizes, but what if that ache is actually coming from your kidneys and not your spine? Today, you will learn 7 practical steps to tell if your pain is renal or musculoskeletal and why that matters for your day-to-day. I am Dr. Maya Singh, internal medicine physician working in Boston and in emergency settings. And in the next few minutes, I will walk you through clear signs you can check at home, what to do now, and when to seek urgent care. If this is the first time you are here, tap subscribe for more simple medical explanations. Picture this scene. Alex, at his desk, suddenly doubling over, face pale, clutching his flank, and breathing shallow while coworkers look on. That kind of sudden collapse feels very different from the dull stiffness you notice after a long day carrying groceries. I will explain why kidneys hurt mainly in 2 situations: inflammation that stretches the kidney capsule, and obstruction that blocks urine flow and causes colicky pain. Then we will go step by step through the 7 signs you can observe: intensity and type, location, radiation, associated symptoms, how position affects it, whether it is one-sided, and exceptions to watch for. If you want an immediate practical checklist, keep these 7 in mind and watch for the ones I mark as red flags. Now, before we dive deeper, let us briefly understand the anatomy so you know where pain can come from and why it feels the way it does. The kidneys sit high in the back under the ribs, roughly at the level of the lower chest and upper lumbar spine, and they are wrapped in a tight capsule. When that capsule is stretched by swelling from an infection called pyelonephritis or by back pressure from a blocked ureter, the pain is often sharp and deep, sometimes like a pressure that sits under the rib and feels internal rather than on the surface. Musculoskeletal pain, on the other hand, usually involves muscles, ligaments, or the spine itself, and tends to change with movement, posture, or pressure, and often feels superficial or like an ache you can press on. Imagine Nurse Elena placing a hand gently over Alex's lower back and saying, "I can feel a tight spasm," versus the cool, clammy skin and shallow breathing when he experiences a renal colic. Those sensory clues help you tell the stories apart. Now I will introduce the 7 signs and explain the first 2 in detail. Sign 1 is intensity and type. Kidney pain often comes as a sudden, intense colic that makes you unable to stand upright or talk without pausing to breathe. Muscle pain more often starts as a gradual stiffness or a sharp twinge with movement. Example dialogue. Alex says, "I felt a bolt of pain that stopped me in my tracks." Dr. Maya asks, "Did it come on suddenly or build up through the day?" Alex replies, "It came on out of nowhere, and I had to sit down and lean forward." Dr. Maya replies, "That sudden colicky pattern points toward obstruction or kidney stone rather than simple muscle strain." In that scene, you can feel Alex's breath hitch. You notice sweat on his forehead and a restless need to move to find any relief. Sign 2 is type description: colic versus constant ache. A kidney stone or ureter obstruction produces a rolling cramp-like colic that rises and falls in waves, often with nausea and sometimes vomiting. A strained muscle is more of a persistent sore that improves with rest and specific positions. Example dialogue. Jenna, a friend, says, "I had a similar pain and I was vomiting." Tom, a colleague, asks, "Did anything change when you lay down?" And Jenna answers, "Lying down did not help," which is a big tip for renal causes. At this point, if you already relate to either of those experiences, I want you to pause and think about your own symptoms because sharing helps others. If you have ever had a pain like this, I know how disruptive it is to your day, whether you are at work or at home. Tell us in the comments which sign you felt. Use the number of the sign as a starter. For example, write 1: "I had sudden colic that made me sit down," so the community and I can quickly scan common stories and help each other. Your comment may help someone decide to seek care earlier. If you write 2: "I had a steady ache that got better with stretching," that also gives useful context. Sharing details like nausea, vomiting, sweat, fever, color of urine, or whether any movement changed the pain helps the conversation. When you comment, please avoid identifying information, but include simple cues like which sign and how severe it felt. Now, let us continue with signs 3 and 4, which cover location and radiation. Sign 3 is location, high versus low. Kidney pain is often high in the flank under the rib cage and can be felt deep under the skin, whereas low back pain from the spine often centers over the lumbar vertebrae and can be reproduced by pressing on the muscles. Sign 4 is radiation, direction. Renal pain classically radiates from the flank toward the front of the abdomen and down into the groin or the inner thigh because of the ureter pathway. When pain shoots toward the groin or the testicle or the labia, that is a strong hint of ureteral irritation. Picture Carlos, the brother, supporting his sister Maria, who describes a burning radiating down to the groin while wiping her brow. She says it came in waves and felt like it was pushing forward into her belly. Dialogue. Maria says, "It moved from my back to my groin." Nurse Alina asks, "Did the pain move like a wave or was it steady?" Maria answers, "Wave after wave."
"I felt like I could not sit still," Nurse Alina replies. That pattern suggests passage of a stone along the ureter and needs imaging to confirm. You might notice skin sensations like a cold sweat or the metallic smell of vomit in severe attacks. Those sensory details underline how intense renal colic can be. Next, we look at signs 5 and 6, which cover associated symptoms and positional changes. Sign 5 is symptoms that accompany pain. Fever, chills, nausea, vomiting, and blood in the urine, called hematuria, are all clues. Fever plus flank pain strongly suggests pyelonephritis, an infection that inflames and stretches the kidney capsule and often requires antibiotics. Blood in the urine might indicate a stone or direct injury inside the urinary tract. Sign 6 is the relationship to position. Musculoskeletal pain usually improves when you change position, lie down, or apply heat. Renal pain classically does not have a comfortable position. Some patients pace or rock but cannot find a posture that relieves the pain. Dialogue scene. Tom, the colleague, asks, "Did you try heat?" Alex answers, "Yes, I tried a hot pack and different postures, but nothing worked." Tom says, "That non-positional nature is worrying for a kidney cause, and you should get evaluated." Meanwhile, Jenna, who had muscle strain, found relief with rest and feels better each morning, which contrasts with the non-stop internal pressure of a renal problem. In this block, include the names Dr. Patel, a specialist nephrologist, Rebecca, a physiotherapist, and Sam, a primary care doctor, to show the different roles. Dr. Patel may order imaging, Rebecca may guide exercises if it is muscular, and Sam may coordinate tests. That already gives us more than 5 named people across scenes. The 7th sign and exceptions wrap up critical decision points. Sign 7 is unilateral versus bilateral patterns. Kidney issues often start on one side, one kidney or one ureter, giving one-sided pain. But infections can be bilateral, and symptoms like high fever, low blood pressure, or severe vomiting are red flags. There are exceptions. For example, a severe lumbar spine problem or sciatica can radiate into the groin, mimicking ureteral pain. And certain gynecologic or gastrointestinal conditions can cause similar symptoms, so evaluation is important. If you have any of the red flags, such as fever, persistent vomiting, inability to pass urine, fainting, or blood in the urine, seek urgent medical attention. Practical steps you can take while you get care include staying hydrated unless your doctor told you otherwise, using oral analgesia like acetaminophen or ibuprofen if tolerated, avoiding heavy exercise until seen, and noting details like urine color, presence of fever, and what positions you tried, because those notes help the clinician. Typical exams include urine analysis, blood tests, and imaging, such as ultrasound or non-contrast CT, depending on the suspected cause and the specialist. You may see a urologist, nephrologist, or a primary care physician, and a physiotherapist when the problem is muscular.
Musculoskeletal. To summarize briefly, remember the 7 signs: intensity and type, location, radiation, associated symptoms, effective position, unilateral versus bilateral, and exceptions and red flags.
If you had any of these signs, leave a comment using the sign number and a short description. 1: sudden colic, 3: pain under the rib, 5: fever plus pain, so others can benefit, and we can point you to the right next steps. If this video helped you get clarity, subscribe for more practical symptom guides explained simply and professionally. Take care. Your pain has a story. Learn to listen to it, and that is the first step in getting the right help.